Good evening, friends. This is Shyam Subramanian. I'm a pulmonologist based in California in the United States. I chair the Clinical Pulmonary Network for the American College of Chest Physicians, and I wanted to provide some information about COVID today. The information I will provide will cover how to avoid COVID, how to know if you have COVID, what to do if you have COVID, and then also talk about a little bit about the black fungus. So first thing is, how do you protect yourself? How do you avoid developing COVID? In order to understand this, it's very, very important to understand the timeline of COVID. So let me explain this in lay terms. The incubation period means the time that you get the virus into your body and the virus is multiplying without letting you know that there is anything wrong. That is the time when the body has no idea that the virus is inside it. And that is the most dangerous time, because that is the time you can see in this graph that you have peak infectivity, meaning that is the time when you are most likely to spread the infection to somebody else without you even knowing about it. The peak of infectivity, the maximum chance of you infecting others, is right before you actually develop symptoms. Once you develop symptoms, that is, you have fever and feel sick and all of that, then rapidly within about a week, your infectivity levels go very down. And by about day 10 or day 11, it's extremely low. So the critical period is actually the period where you will have no idea that you even have this infection. We all know that masks protect us, and so we have to wear masks. But I think some of us feel that masks actually protect us from getting the infection. In fact, it is the other way around. The mask we wear is what is protecting others. So we are protected when others are wearing masks. That is why it's so important for everybody to wear masks. It's important to understand this. So if you are exposed to a person without you wearing a mask and the other person is also not wearing a mask, that is the highest risk. That is almost a certainty that if that person is infected, you're also going to get infected. But if you wear a mask and the other person is infected but is not wearing a mask, that is also an extremely high risk situation. It's in fact almost no different than if you were not even wearing a mask. But if the other person who is infected, who is carrying the virus, is wearing a mask, then the risk of you getting it is quite low. So his wearing the mask is actually what is protecting you. Similarly, if you are infected, your wearing your mask is what is protecting others. Ideally, both of you wearing a mask and socially distancing at least 6 feet is going to be the most optimal protection. Vaccination is absolutely key in prevention. The most important thing is to get yourself vaccinated. It doesn't matter if you have heart disease, diabetes, any kind of medical conditions, if you're old. In fact, those are risk factors for serious COVID, and even more reason for you to get the vaccine. The best vaccine is the one that you can get the most quickly and the most easily closest to your facility without necessarily having to travel long distances or go to a crowded place and get yourself exposed. So please try to get yourself vaccinated at the earliest. Next, we talk about how do I know if I have COVID. The two commonest symptoms are fever and loss of smell and taste. So if you have these symptoms, then immediately get yourself COVID tested. Other symptoms could include headaches, being fatigued, cough, sore throat, body aches, and things like that. First thing you can do is a rapid test. These results can come back within an hour or two if you have it readily available. Unfortunately, if it is negative, it doesn't completely rule out COVID. So still continue to be careful. Don't presume just with a rapid test that you don't have it. You have to do also an RT-PCR. RT-PCR takes about a day to come back. Important that even an RT-PCR could be negative in about 30% of the time. So if you have a lot of symptoms like fever, loss of smell, don't take a RT-PCR test as being negative as the fact that you don't have COVID. You still need to keep isolation, still need to treat yourself as though you have COVID until you get a second RT-PCR test in about 1 to 2 more days. Next, what do you do if you do actually have COVID? First things first is don't panic. More than 90% of the time you will recover completely fine. Nothing is going to happen to you. The only thing you will do by worrying about it and getting panicked and getting stressed is lower your body's immunity and more likely end up having a more serious course. So stay calm and stay positive. These are common agents that are being used today, widely prescribed in the market. Ivermectin is mainly used for worms in the stomach, hydroxychloroquine for malaria, doxycycline for antibiotic, and yet these are all being very commonly used in COVID. None of these have any role to play in COVID infection. So do not waste precious time with that. The one antiviral agent that can be used is favipiravir. The dosage of it is 1800 milligrams twice a day on day one, and then 800 milligrams twice a day, day 2 to 14. It comes in different brands. Pretty much you can take any brand, but make sure you start this early. The thing with antivirals is you have to start it extremely early, because only the first 2 to 3 days is where the virus is really multiplying rapidly. If you wait about a week after you develop symptoms, by then it's too late for any antiviral to be working. Remdesivir has been approved for use in many countries for COVID. However, again, it is only effective if it is used extremely early, but remdesivir is typically used much later when patients are in the hospital. They already have are on oxygen. In that kind of situation, it will have any very limited role. So remdesivir in an Indian context, especially because of very high cost, very difficulty in great difficulty in procuring it, and the need for being hospitalized, is probably having a very limited role. Steroids are also being widely prescribed. They're widely now known to be effective in COVID. However, it is very critical to understand when to give steroids, and more importantly, when not to give steroids. Let's look at the timeline again. So after you develop symptoms, for about the first 5 to 7 days is the viral phase. This is when the virus is multiplying. This is when you should be using an antiviral like favipiravir to prevent the virus from multiplying. After that comes what is called the inflammatory phase. In simple terms, that means this is the response from the body to the virus that is trying to kill the virus, but is also harming the body and causing inflammation. So it is this inflammation that steroids are going to prevent. So do not use steroids in the first 5 to 7 days when you're not in the inflammatory phase. It is only harming you. It is going to lower your body's immune system, allow the virus to multiply, allow the virus to grow faster. But definitely in the inflammatory phase, it has a role, and you can use either dexamethasone or methylprednisolone. Once you're in the inflammatory phase, you have to start monitoring your oxygen levels. This happens by day number 5 to 7, and you want your oxygen levels to be above 90. It doesn't matter if it is 94, 93, 92, those are all perfectly fine. Do not panic if those levels get to that level. Only below 90 does your body really need extra oxygen, like you may end up needing an oxygen concentrator at home, only in that kind of scenario. Lying on your belly, or what is called proning, is a very important measure for you. So as soon as you start to feel short of breath, if you're in the inflammatory phase of week 2 of COVID, try to be on your belly most of the day. If you need to take a break, you can spend 30 minutes on the right side, 30 minutes sitting up, 30 minutes on the left side, then again go back to a few hours of lying on your belly. One important question is, how long do you need to self-isolate? The answer is at least 10 days. Everyone in your family also needs to self-isolate. The self-isolation, if you don't have any symptoms, is 14 days, or 10 days from the time that the other family member gets symptoms. So the duration of self-isolation can vary depending on when you start getting symptoms. But if you have no symptoms at all, then you self-isolate for 14 days. If you are sick and have symptoms, you self-isolate for about 10 days. A word about black fungus: a lot of coverage in the media, a lot of panic about it. Black fungus is not occurring independent of COVID. This is occurring from a fungus called mucormycosis. It is occurring only in a very small percentage of patients who have COVID. And so there is no need for the general public to start panicking about whether they may get black fungus. People who develop COVID, who are elderly, who are diabetic, who are on steroids, these are typically the patients who are getting it. And the symptoms can be redness in the eyes, or pain around the nose, or um, fever or headaches. And so if those types of symptoms occur if you have COVID later in the course of the COVID illness, then definitely seek urgent medical attention. So thank you all for listening to this message. I will try to produce more educational content and upload it in this channel. Thank you.